Hi everyone, today I want to talk about an adaptive feeding utensil that may help some children with feeding difficulties. This tool is particularly helpful for children with oral motor challenges. This can include difficulty forming a seal with your lips or coordinating movements with your tongue to create and manage a bolus or chewed up food. These difficulties can lead to frustration during mealtimes and impact nutrition in social experiences. So to support these children with oral motor challenges, we want to introduce the Easy Eaters Curved Utensil. This adaptive feeding utensil is designed to address several key issues. So this is for if you're right-handed, this is for if you're left-handed. So when you're holding it, it's kind of curved more towards you. And the curved design helps children with poor coordination bring food to their mouths more easily, reducing the effort required and making mealtimes less frustrating. The utensil also features a large textured grip that is easier for children to hold to help them develop that grip strength and have better control and independence during self-feeding. Also, the shallow spoon design assists children in maintaining a better lip seal, preventing food from spilling out and improving their overall eating efficiency. Let's talk about Ava Baker, a 3-year-old girl with Pierre-Robin sequence. This is a condition characterized by a small jaw, tongue positioned further back, and a cleft palate. Despite undergoing cleft palate repair, Ava continues to experience oral motor delays and feeding difficulties, specifically with poor lip seal, incoordination, and weak grip, making it difficult to grasp a utensil, self-feed, and create a bolus for solid foods. These challenges are common in children with Pierre-Robin sequence and can significantly impact their ability to eat and enjoy mealtime. I am now going to pass it on to Amanda, who will talk more about the feeding tool, its parts, its functions, and how they are used to support Ava's feeding difficulties.
In the case of Ava Baker, our 3-year-old with Pierre-Robin syndrome, these spoons will be particularly beneficial, in part due to their curved design, again, because Ava has decreased coordination, and this affects her self-feeding. With a curved spoon, she is able to more accurately bring the spoon to her mouth with decreased coordination and still be able to feed herself. At the age of 3 years old, we all know that 3-year-olds would love a bit more independence. Ava also has decreased grip strength and often struggles to hold a crayon. Because of this, these spoons, the way they are, they're a little wider in the handles than a traditional spoon. They make it a little easier for her to grip and hold to perform self-feeding. Ava's also described as a messy eater who often has food spill out of her mouth. This is categorized medically as an individual with a weak lip closure. The shallow design of the spoon in this instance will allow for better lip closure around the spoon, resulting in less food lost out of the sides of the mouth. Ava may have a cleaner face during and after eating due to the design of this spoon. In this next section, we'll talk about these utensils made by the company Easy Eaters. Easy Eaters makes spoons for individuals who need an adaptive method to eating. Adaptive means just a little different than what we may typically use in terms of utensils. The spoons and forks they make are made in both right-handed and left-handed varieties, making it easy to tailor them to your patient's or child's specific needs. With these spoons, you'll note that they have a more shallow depth, which allows for less spillage when children are feeding themselves. The curved handle is also atypical of a normal spoon, meaning that this curved handle is easier for individuals who have limited dexterity in their hands, meaning, maybe they have a difference in range of motion or just general movement differences than what you and I would typically have. So this curved spoon allows them to bring the spoon or fork to their mouth easier. On here, there is a guard that actually is called a shield, as you can see. But what the shield does is it prevents the utensil from going too far into the mouth. This is particularly helpful for people with Pierre-Robin syndrome, in which their oral cavity, aka the mouth, is already a bit further back in position than a typical mouth would be. Inserting the utensil too far into their mouth could cause injury. With the shallow depth and angle of these utensils, as well as the shield, these are more beneficial for individuals with Pierre-Robinson syndrome.
Okay, so now I want to touch on how to use the Easy Eaters curved utensil. So the first important thing is you want to choose the correct hand. These utensils come in left or right-handed versions, and you want to make sure you're giving your child the correct one for the dominant hand. And to be sure, the curve should point towards the child's mouth when they're holding it. And you're going to want to show them how to hold it. So help your child grip the handle, and it should be soft and easy to hold. And the curved shape is designed so they don't have to twist their wrist too much to get the food to their mouth. You're also going to want to guide their first few bites. You can place your hand gently over theirs to guide the motion, and the curve allows the utensil to follow a more natural path from plate to their mouth, which makes it easier and more comfortable. You also want to practice with soft foods. They're easy to scoop, like mashed potatoes or small pieces of banana, because it helps build confidence. And you really want to encourage independence. So you want to let your child use it when they're ready and comfortable. And it's okay if they're messy at first, because that's part of learning. And these utensils are usually dishwasher safe, but the packaging, you're going to want to check the packaging to confirm. And they need to be cleaned thoroughly after each use. So some common pitfalls and troubleshooting ideas here is sometimes using the wrong-handed utensil can be an issue. So what you want to do there is double check hand orientation. So look at how your child naturally reaches for objects to make sure that they're given the correct utensil, either left or right-handed. Your child may initially hold it like a regular spoon or fork, and in that case, you're going to want to model the movement. So demonstrate to them how to hold a utensil slowly and exaggerating the curved motion towards your own mouth. They may also have issues with overstuffing or scooping too much. So children might scoop large bites, which can cause spillage or gagging. So what you're going to want to do is start with easy to scoop foods, as I kind of mentioned earlier, like oatmeal, applesauce, or mac and cheese that can actually stay on the fork better. And they may have an issue, or there may be an issue with not aligning the curve of the utensil toward the mouth, which is really important. The curved angle is meant to help bring food towards the mouth with less wrist movement, as I said. And some kids may turn it incorrectly. So what you can do here is use verbal or visual cues, simple reminders like the curve goes towards your mouth, or placing a sticker or small dot on top of the handle to show the right way can also help as a visual reminder. And in relation to texture, inversion, and pickiness, it's best to try to reduce frustration and approach mealtimes with a positive attitude so that they can correlate that with a positive experience.